Hello everyone, my name's Rob. I worked for 16 years as a registered nurse in inpatient mental health settings. I worked mainly in adult mental health as well as in psychiatric intensive care, eating disorders and child and adolescent mental health units. I now work full-time as a stand-up poet. If you don't know what stand-up poetry is, don't worry, it's a bit niche. It's like stand-up comedy but it rhymes and there's no jokes in it. All too often, when someone is given a mental health label, everything they then say or do is seen in the context of that label. And it can be very hard for people to shake off the labels that they get given. One of the most rewarding things about working as an artist in mental health settings is that you can help people transcend those labels in an empowering and creative way. And that also applies to clinicians and staff, as well as the people receiving mental health treatment. Quite often, I will go into inpatient mental health settings and compose what we call the group poem. So the way this works is I'll turn up on a ward with a flip chart, and it doesn't matter what kind of ward it is. It could be adult mental health, it could be child and adolescent mental health, it could be a dementia setting. It really doesn't matter. I'm there with the flip chart in a communal area, and I write the poem in real time while everyone in the room shouts at me. And so the poem is a composite of all our thoughts and ideas that go into it. And between us, we create something brilliant. One particular occasion, I turned up at an adult mental health unit to do the group poem. So I've got my flip chart, and the ward was a little bit volatile, and the staff there were going, "Look, Rob, we don't know if it's a good idea today." And we had a bit of a chat and decided that we'd risk it for a biscuit. And so I'm there with the flip chart in the day room, and the reason the ward was volatile was that a patient had gone AWOL, and she'd gone to the local shopping centre to get her nails done, as you do, and the police had come and got her when she was halfway through the process. And of course, the police haven't got time to hang around all day while you get your nails finished. So they basically picked her up and brought her back. She'd got 3.5 nails done, and the rest of them all incomplete. So she'd taken that quite personally. And so she was on the ward feeling really, really angry. Her anger had rubbed off onto quite a few of her fellow patients, and there was most definitely an us and them atmosphere between patients and staff on the ward. So I'm there with the flip chart, and we're having a conversation about what we're going to write in the group poem, and I'm talking to this patient. Over the course of the conversation, it transpired that she found one of the coppers quite attractive. And so we decided to compose a love poem to him, just in case they ever meet again in the future under similar circumstances, so she could perform this love poem for him. And it was beautiful. Within no time at all, staff and patients are all throwing lines in. We're all falling about. We're all having a great time. It wasn't the most tasteful poem ever composed. However, it helped improve the ward atmosphere. It brought staff and patients together over a common idea, a joke. And this is really important for us as artists. I think all too often in mental health, we can forget that it's a basic human need to connect with the people around you and to relate with the people around you, and also to have fun and a laugh with people. And that need doesn't go away because you're tormented, or because you've got a mental health problem, or because you've been admitted on a section. In fact, actually that need increases at those moments in time. And as artists, what we can do is help people transcend those labels that they've been given in quite an empowering way. We can help people stay out of hospital simply by reducing social isolation. We know that social isolation makes you more likely to relapse and more likely to get readmitted. And it's quite common for people to tell you that you're the only reason they leave the house once a week to come and do whatever workshop it is you're doing with them. And so in that sense, the art is a little bit secondary to the socialising of just getting together with people and creating something great that they can be proud of. And it's actually really empowering. Sometimes you're helping people fight back simply by helping them find their voice. Or make a comment. One of my favourite ever comedy asylum sketches was Dr. Macbeth, who is a psychiatrist, and the three witches are all pharmaceutical representatives, and they're making really valid points about the power of the pharmaceutical companies, but they're actually doing it by having a laugh. And because that particular show, they've got a whole audience of people laughing as well, you're actually doing your bit to help reduce stigma. Any of us can have a mental health episode at any time in our lives. And we're all capable of being beautiful and ridiculous, whether we've got a mental illness or not. And so when life does take us too seriously, it's more important than ever to find joy in the things that we can create, and sometimes to find joys in everyday absurdities. And as artists working in mental health, that's what we help people do.